Okay, so for the last 9 or so years the show's been going, I don't think I ever got as many comments. In fact, so many comments, the issue was trending last night on Twitter. Facebook, about 300 comments. How much does it cost to go and visit your local GP? I took to the streets of Wellington. Here we go. How much do you pay when you go to visit your GP?
Nothing.
About $15.
Currently it's $50.
$46, $47.
Oh, I don't have a GP, bro. I don't go to GP. I'm my own GP, bro.
$45?
No, I'm all good, eh? I'm sweet, yeah.
Oh, how come?
I'm a student, so I don't.
Oh, fantastic, amazing. What about you?
Same student, so free.
So, no, free.
Yeah.
I pay $90.
Far out. It's a lot of money.
$90. You wouldn't go then, would you, very often?
Stupid, mate. Yeah, what's the point in that? What's the sense in that, bro?
90.
Would you go to the doctor for that?
Nah, probably not. Just have lemon honeys at home.
What do you reckon it should be?
Well, $30. It's maybe like 30, 20s, but
20 or 30?
more affordable.
It should be free.
15, 20 bucks.
$20.
Keep the old physical activity up, you know, that's number one, eh? The old cardio. Got to go hard on the old cardio.
You look pretty fit anyway.
Yeah, I am, yeah. Feel good as too, bro.
Hey, so here, it shocked me. The variation really shocked me. I pay $90 Auckland CBD, all right? So what have we got? People were saying Glen Eden, $17, $7 in Thames, Kapiti, 60, 40 Papakura, 15 the Colville Medical Centre, 55 Takapuna, 17 Epsom, 30 Avondale. It goes on. $80 Wellington CBD. Hayley, before you go to the guests, can you go around the audience? How much do they pay? Just a few people. How much do they pay?
Okay, over here.
For their GPs.
The bring back benches to Christchurch. How much do you pay?
Well, when I lived in Christchurch, I paid $17.
Wow.
And I pay $17 at the Newtown Union Health Centre.
I think everyone's going to be going to Newtown soon. $17 sounds pretty good. What about you over here? How much do you pay for your GP visits?
$65 in Wellington. It was about $15 at some whānau order place in Mount Roskill, Auckland.
Whānau order. There we go. What about yourself? How much do you pay for your GP visits?
Around about $50. Should be 20.
Yeah, well, it's all over the place. I pay 60, I think.
All right, okay. So what about them? How much does around the panel? Jono, how much does your GP cost?
I think about $40.
Okay, 40. What about you, David?
Total Health New London, $40.
$40, Marama?
Whai order in Masterton, $16. That whānau order. There you go. Hashtag Kiwi treason.
Will you stop that?
Hashtag self-promotion.
Look, it's a kaupapa Māori model of practice. If price is going to be the barrier to health in this country, then we have to do something about it. We did. Māori Party. Thank you.
Okay, all right.
Yeah, get national power.
Well, my question is...
And we got free under 13 doctors' visits.
Did you realise the massive variation? Did you, and why so different? Jono, why is it so different?
Yeah, look, I mean, obviously, there's a level of government subsidy that goes through, and then doctors are free to kind of charge actually.
But it's all over the place. There seems to be no uniform policy.
They pay for pretension.
Yeah, so look, there is no uniformity. If you want to have uniformity, then you're actually going to get into a whole different structure around your health system, and you're going to start telling GPs what they can and can't trust, and that's a complete remodel of the way that the GP practice system
why
works.
we're talking about it is because there's a creep, and it's getting up to an average of about $70, and what we are seeing, and what I saw on the hundreds of comments on Facebook and Twitter is that people now are starting to not go to their GP, John and Naylor, because they can't afford to. They'll put it off.
What do you mean starting to? That's been the barrier for Māori forever. Forever. They go to Dr. A&E. This is not a starting to. This is just, hello, the rest of the world has found out what it's like.
What do you mean by that, Dr. A&E?
Accident and emergency.
So they'll go there instead of their GP.
That's
they'll
right.
go...
Yep. So, look, Marama's right to represent the particularly tough situation of Māori, but let's not forget, this is a party that's locked in confidence and supply, keeping National in office, that has ripped $1,700 million out of the health system since they took office. Set 1.7 billion short on what it would have cost to keep even. So what I don't think we should hang on, let's finish the sentence.
Yeah, all
what
right.
we shouldn't have
around the panel first. Yeah.
Let's not have born again socialism from a party that's keeping the Tories in power.
Socialism. Hello, welcome to our world.
You heard that. Basically, what's happening? Nat's cut $1.7 billion for health across 6 years. So it's
free under 13 doctors' visits is a Māori Party policy. Free under 13 doctors' visits is a Māori Party policy that we push this government to do.
And the earth was created in 7
Excuse me, you've had your
days.
turn. Now, here's the thing. This is the social cloth cap wearing party who pretend that they're the only ones who look after us. That is not true.
We're not keeping
you
national
can go
power.
to the doctor for $16, and in some places
you
can
can't.
go.
I'm happy to finish answering
No,
the
it's
questions
not
that you asked me.
uniform. Jono.
Yeah, so look, what I think you've got to bear in mind is actually, look, there is subsidies in place that those GPs are getting those. There is the VLCA thing in place, which actually needs to have a look at, but we've got to understand before we make any change that what the repercussions are, so we don't actually end up having other people who potentially pay more than they are now. One of the difficulties with the current VLCA system is that actually 1.3 million people are accessing it.
This is the low-cost system. This is the low-cost system. All right. David, hang on. No.
Really simple.
I'm going to go to the doctor and then go back to you folk. All right.
Wallace is I'm going to go to the doctor. I found a GP. Larry Jordan, first of all, epic name. Did you play basketball?
No, but I admire the basketballer.
Okay, so why are they so diverse? These prices, $15 to $70 to $90.
The fees are all over the place because the funding is all over the place. It's just not even, and instead of going where it needs to go, it goes to where it's historically gone.
And where has it historically gone?
Some practices and some services, Whaiora is one, a great service, although I'd have to say that they're struggling, like so many low-cost services are. They get extra funding in a variety of ways. Some of that's under threat. Many other practices don't get extra funding. Lots of people with high needs go to practices that don't get extra funding. Some people who don't need extra funding go to the practices that do get it. It is all over the show.
So what do you want to see happen? Do you want to see doctors get subsidies across the board?
We'd like to see the funding follow the need. So the people who need the funding should get the funding wherever they are and whoever is giving them the service. Pay our...
I like that.
Pay our health professionals not excessively but well, because they work really hard and they are not overpaid.
I'm going to say you guys do get pretty good money. Are you guys greedy?
Absolutely not. In primary care, we're really struggling to recruit workforce. We need to pay our nurses enough so that they want to do this valuable work and keep people out of accident and emergency, actually, where it costs 10 times as much to be looked after.
$90 were for a visit, which could last 15 minutes. Seems quite a lot.
That is very much at the high end of the scale, and you'd have to check out what the costs were and exactly what the parameters of that sort of practice were. $40 is closer to the average mark for an average subsidised situation.
Is that what you charge?
Close to that.
Do you get people who come in, because I do this, I'm not going to tell a lie, I sort of build up my problems. I've got about 5 issues that I want to go to my doctor with. Do you have a cut-off?
Well, you do the best you can. Sometimes you just can't fit everything in, and you do your best you can too to use all the resources available. So I mentioned nurses before. They can do a lot of things that are really helpful as part of a team approach. But we need to look after the team and make sure that it's effective. And more importantly still, we need to get the funding following the patients. And we need to get some degree of sensibility and uniformity about it as well. There's been a real sinking lid that David referred to before, so a lot of money has been taken out of our funding over the last several years. It's not even kept up with inflation anywhere near, let alone taken care of the new needs in the community. And we just need to get things a little bit more equitable right across the country, and that's between our DHBs as well.
Okay, Wallace, what do the MPs think about that?
Thank you very much. Thank you very much for coming along the show. That's great. A bit of clarity around that. I mean, it just seems to be such a schmozzle, this issue. Sure so, is. David, what if you're in power next year, perhaps? What would you do about it? This low-cost scheme, capped since 2009. What would you do?
Well, I agree with our practitioner. The funding should follow the need and it should be uniform across the system. Labor will do 2 things. Firstly, we will restore better resourcing for healthcare, and secondly, we're going to move upstream to try to keep people well. This government, for example, took obesity out of the health target.
What does that mean?
It means public health and preventive stuff like bowel cancer screening, like healthy eating, healthy action. Like, no, you could save more lives than the road toll on that one. And I passed it when I was Minister of Health back in 2008. National dragged the chain, and only 7 years later, that's thousands of lives unnecessarily lost. Later, we're starting to see a pilot rollout.
Can you see what the experts are saying? The funding needs to follow the need, and you guys aren't quite up to that, are you?
Look, I think
it's not happening.
I think everyone would acknowledge that actually we need to have another look at the way that the GP service is being funded. The model isn't necessarily perfect, but before you change it, you've got to always look at what the unintended consequences are. And potentially you can change a model and then find that there's a whole lot of people who end up paying more because you've equalised it out. So you've got to be a little bit careful about that.
Property
So as I
speculators
said at the
and really
moment,
rich people.
1.3 million people receive that very low-cost service at the moment, but actually only 700,000 of them... I'll just finish, David, if that's okay. The 700,000 of them aren't actually low-cost people. So, yeah, we do need to tweak the system to make sure that the people who actually need it are receiving it.
All right. Your thoughts on what the GP said?
No, we need to listen to our GPs. We need to listen to the people who it affects most. So we are not the dog, we are the tail. So what we try to do is implement change where we can. So increase bariatric surgery, Māori Party policy. Free under 13 doctors' visits, Māori Party policy. Rheumatic screening around this country that has had a huge effect on the health of people. They're implementing them.
We've implemented those
We bring them to them, they're implementing them. But they keep themselves in power because actually they won the election.
Okay.